Hello, my name is Ryan Griffo, and this is Health and Wellness. Today I am honored to be joined by Dr. Cuckoo Choudhary at Jefferson Health, and we will be speaking today about Crohn's disease. Doctor, thank you so much for being with us today. My first question for you is if you could please explain Crohn's disease. What is it, and how does it affect the body?
Thank you, Ryan, for having me here. Crohn's disease is a chronic inflammatory condition of the intestines that can affect the intestines anywhere from the mouth to the anus. Usually, people that have it can have abdominal pain, diarrhea, blood in the stools. Sometimes they can have fever, ulcers in the mouth, joint pain, and weight loss. The reason they have weight loss is they either don't have an appetite or they are afraid to eat, because when they eat, they have abdominal pain and diarrhea. So to prevent that, guess what they do? They stop eating.
That's correct.
It can affect anyone at any age, but the commonest age group where it starts is usually in the early 20s to 30s and 40s. But we see kids as young as 5 to 6 years of age, and as old adults as 60 years of age that are first having this condition.
Absolutely. And following that, what are some of the most common treatment approaches for Crohn's disease?
So, for Crohn's disease, as I tell my colleagues, we have come a long way, and we have a long way to go. So what we describe as the first line treatment are medications that we call the 5-ASA drugs. These include drugs that are available in the market by the name of Aprizo, Lialda, Pentasa, Azicol, Colazol, Delzicol, sulfasalazine. These are tablets that can be taken by mouth. But these can be used only for mild cases of Crohn's. Then you have the more severe cases in which you have the anti-TNF drugs. And there are 3 in this category. Remicade or infliximab, that most people that have Crohn's disease know about. That is given in the form of infusion, and that can be given anywhere from every 8 weeks to every 4 weeks after the first 3 infusions. And then you have Humira and Cimzia, which are same cousins of Remicade but can be taken in the form of injection.
Okay.
There are lots of other drugs. A newest drug that was approved for Crohn's disease is something called Entyvio, and that was approved in May of 2014. That is also given as an infusion. That's for 30 minutes and is given every 8 weeks. We have methotrexate, which is a long, old drug, but the gastroenterologists have only recently become comfortable with it. Why? Because it can cause abnormal liver enzymes. You have other immunomodulators that are given as tablets called 6-MP, and it's prodrug azathioprine. And these are available under the name of Imuran. So, and there are many drugs. I could go on and on for 15, 20 minutes and still not be done with the long range of drugs that we have for Crohn's.
That's fantastic treatment approaches and being used today as well. My next question for you is we hear a great deal about the gluten-free diet and how it is related to celiac. And is there a certain diet that patients with Crohn's disease must follow? If you could bring any input into that.
Yeah, so let me be very honest. First of all, celiac is a different disease, as you just said. Celiac is a condition in which the person is intolerant to gluten. And gluten is present in wheat and certain other grains. So that's different. Now, coming to diet and Crohn's, honestly, there is no diet in one line that will decrease the inflammation in Crohn's disease that the medical science knows of. Now, having said that, patients that have narrowing in the intestines from Crohn's disease or those that have had surgery, they are asked to avoid too much fiber in the diet. So they need to avoid large salads, fresh fruits, and why? So that they do not develop blockage. So just so that I make it clear, it is not going to make the intestines more inflamed if they were to eat salads, but it may cause blockage.
Okay.
So no diet for decreasing the inflammation, although many books have been written by non-physicians on this. But the medical science does not know of any diet.
Very interesting input
Yes.
there, absolutely. My follow-up question to that is, how common is Crohn's disease and other diseases that are related to Crohn's that may be mistaken for Crohn's disease?
So, unfortunately, the incidence of Crohn's is on the rise, as we say. The incidence in the US, in our country, is anywhere from 1 to 10 per 100,000 of the population. So that's quite a bit, depending upon where you look at. Illnesses that mimic Crohn's disease, yes, there are quite a few. Its cousin, ulcerative colitis, which usually presents with bloody diarrhea. Certain other cousins like microscopic colitis, ischemic colitis, and you can differentiate all of these by a few tests, by doing colonoscopy, and also by doing certain other specialized tests to look inside the small bowel, such as a specialized kind of MRI called MRE, a specialized kind of CAT scans, and so on and so forth.
Very interesting. Thank you again for that. And my follow-up question, what are some of the advancements that doctors and researchers are testing that we could see in the near future to eventually treat Crohn's disease?
So research is being done in Crohn's in different areas. Since we don't know the exact cause, we are still trying to look for that. So studies are being done in the genetic area to look at and identify the exact genes and if they can be modified at any level so that either the person does not develop the disease or develops the disease at a later age or develops a milder form of the disease. And then there are researches being done for treatment. So the main area that we are focusing on right now are what we call biologics. And biologics, some of them I mentioned to you, the Remicade, the Cimzia, the Humira. So most of the research is getting done in that area because those are focused on certain areas of the gut, the GI tract, and therefore will not give rise to a lot of side effects in the patients.
Okay, definitely. Doctor, when a patient gets to a point where they are in need of surgery, what options does that patient have?
So there are different surgical options for Crohn's disease. When a person who has Crohn's involving a portion of the colon is not responding to any of the medications that I mentioned to you, or say any of the research medications, that part of the colon can be removed and they can be hooked back up together. In some cases, when they develop a narrowing in the colon or in the small intestine from the disease, that narrowing can be removed and the healthy parts of the intestines can be hooked back together. The third scenario is when the entire colon is involved with Crohn's and they are not responding to medications. In that case, the best option is removal of the entire colon and giving the person a permanent bag called an ileostomy. And that is a small bag that they wear it on the abdominal wall. And you'll be surprised how well patients do with that after they have initially adjusted to the bag.
That's fantastic. Thank you so much for that information. My final question for you today, there's been a lot of talk about fecal transplants. Can you offer your input on that?
Yes, so fecal transplant, let me start off by saying, was first started for infection in the colon, specifically Clostridium difficile, also called C. diff colitis. And that is where we, in 2016, see a role for fecal transplant. For Crohn's disease and for its cousin, as I said, ulcerative colitis, the role of fecal transplant today is not clear. Not to say it will not become in the future, but right now, this is not the standard of care or has not been shown to be beneficial in Crohn's disease.
Okay, doctor, thank you so much for all this fantastic information about Crohn's disease. And we really do appreciate your input, and thank you once again for being here today. For Health and Wellness, my name is Ryan Griffo. Thank you for watching.